Our project describes the implementation of an electronic healthcare record for Washington Memorial Hospital. It is our mission to initiate, plan, execute, and control an electronic healthcare record that meets the needs of Washington Memorial Hospital, a 1,000-bed hospital in urban Washington, D.C. Our goals are to complete the implementation of an electronic healthcare record in 1 year's time, and by doing this, we hope to improve the efficacy and patient safety through the use of a paperless electronic healthcare record. In order to grasp the full scope of this implementation, Microsoft Project was used to outline the tasks to be undertaken. Once a start date of June 28, 2007 was established, tasks and subtasks were given specific timeframes for their completion. The 7 major high-level tasks include patient information management, laboratory, pharmacy, radiology, imaging, nutrition and food service, and lastly, clinical information systems. Note that the finish date for the entire implementation of the electronic healthcare record is June 30th, 2008, within the time frame schedule. In order to make the project move efficiently and timely, we made several assumptions. Training is dependent upon the configuration of a particular subtask. This means that once the configuration is complete, only then can training for that subtask begin. Once the configuration of one subtask is complete, it can immediately begin for the next subtask. These assumptions are made in order to maximize the use of our resources available for this project implementation and allow timely and efficiently completion of this project. For the first subtask, patient information management, components are further broken down into subtasks: patient registration, admissions, discharge and transfer, and patient scheduling. Within each subcategory, time is allocated for the configuration and training. The project implementation start date for patient information management is June 28, 2007, and its scheduled completion date is September 6, 2007. The laboratory task is divided into subtasks: chemistry, microbiology, and anatomic pathology. Again, within each subtask, time is allocated for configuration and training. The scheduled project implementation start date for laboratory is September 7th, 2007, and its completion date is October 25th, 2007. The pharmacy task involves subtasks: inpatient-outpatient, electronic medication administration, barcode medication administration, and adverse reaction tracking. Note that the subtask, adverse reaction tracking, requires that the configurations for inpatient-outpatient, electronic medicine administration, and barcode medicine administration be implemented and completed before the configuration of this specific subtask can begin. The project implementation start date for pharmacy is October 26, 2007, and its scheduled completion date is January 15, 2008. The radiology task involves 2 subtasks: general and nuclear medicine. Its project implementation start date is September 7, 2007, and its scheduled completion date is October 25, 2007. The task for imaging involves subtasks: clinical image viewer and document imaging. Its scheduled project implementation start date is October 26, 2007, and its end date is November 9, 2007. The task nutrition and food service involves 2 subtasks: food service management and clinical nutrition. Its project implementation start date is September 7th, 2007, and its completion date is September 21st, 2007. The Clinical Information System task is divided into two parts for easier viewing within this slideshow. The Clinical Information System subtasks include the Clinical Rules Engine, Intake and Output, Patient Education, Order Management, Results Reporting, Vitals Measurement, Clinical Documentation, Computerized Provider Orders, Clinical Alerts and Reminders, and Consults Tracking. The project implementation start date for Clinical Information Systems is January 16th, 2008, and its scheduled completion date is June 30th, 2008. Microsoft Project can easily be manipulated for adjustments in the project timeline. For example, let's assume that the administration discharge and transfer configuration was completed 3 days ahead of schedule. Note that the training is able to begin earlier, and the total time for completion of the project has also moved up 3 days, from 263 total days to 260 days. Using Microsoft Project was an eye-opening experience. Microsoft Project promotes efficiency and efficacy throughout the organization in order to implement a common goal. Once we were trained to use Microsoft Project, it proved very useful and that it provided multiple ways to view the progress of the implementation and to truly see where resources were being allocated. We appreciated that Microsoft Project allows each stakeholder in the implementation process to view the project's progress, hence fostering a sense of teamwork throughout the organization. Thank you for viewing our